It is our weekly installment of vital information from our friends at
Wellness by Design.
Wow.
It's been a full week.
Just slap me on the back. Wellness by Design. Dr. Connie's not here, so I got confused. We've got, of course, Nicole Kelly. Hello, Nicole.
Hi.
And Stephen Mulligan. How are you?
Hi. I'm good.
So Dr. Connie sent you on a mission today to tell us.
Call, this is your patient liaison.
That's true. But
And
what
this is the guy that's giving you the IV.
That's exactly right.
I love it. I love it.
He's dressed pretty sporty this morning.
Yes.
But we're talking about the IV bar, right?
Right.
All right,
Right.
tell us about it.
Sure. So, you know, my favorite part of the job is the patient liaison part, where I get to meet the new patients and they come in and they've got some issues they're looking to control or deal with. And so finding the solution for them is the best part. And so many new patients come and say, wow, if I would have just known about this IV bar sooner, I would have come sooner. So that's our mission today, is to get the word out and let people know about the power of nutritional IVs.
And I love, because if I would have known Steve was the man behind the thing, I would have been there a long time ago. Steve, give a little bit of your history.
I am a former ER nurse. I say a recovering ER nurse.
Yep.
I've done some home health. I was director of emergency services at a local hospital. So I've been in healthcare for a long time. Started looking at natural and homeopathic type medicine about 15 years ago.
Well, break down the benefits again for this.
One of the things that we talk about a lot is we all take supplements. Who doesn't take
Yeah.
vitamin C's and stuff like that? But the reality is we only absorb about 15 to 20% of those supplements. So we offer nutrition that goes straight into your IV and you get 100% of that benefit of that.
And it bypasses the organs, I guess, the stomach, like a pill would have to.
The pill has to go through your stomach. Your digestive tract has a lot to do with it. If
Right.
your digestion is not great, which most people aren't, then you're going to absorb even less.
And it's like that too. I mean, people get we were at an event last weekend and someone was getting sick leading up to it, and they were like, you got to go to Wellness by Design and they will give you that. I mean, they were coming down, I don't know what it was, but like the next day they're like, oh my gosh,
It's instant. It really is.
I made it. I
One
feel
of-
so much better.
What does
Yeah.
it take, an hour for an IV, 90 minutes? I
About.
forget. Okay.
About an
One
hour.
of the things that we're focusing on right now, because we're in flu season, so people get colds and flus, and we have a vitamin C special where we give a high dose of vitamin C. You will never take that much vitamin C by mouth. And we give you a lot of vitamin C, B complex, and some of the B vitamins, and it will make you feel
And
better
you can't
quicker.
eat enough oranges to equal that amount of vitamin C.
That's right.
Is there a minimum age to have this done?
No.
No, just parental consent.
Safe, yeah.
Because Nicole, what if somebody, they're watching, they're like, I just don't feel great. I don't know what it is, but I mean, would they come and
Yep.
talk to you and then you kind of figure out?
Absolutely. So they come in and they can have a consultation and we can go over if there's specific things they're looking to do. Like some people come in and say, I've been working out every day, 2 hours a day, I can't seem to lose weight. So we might recommend our metabolism booster or fat burner IV. And so that sort of thing will help get them to their goals. As Steve said, we have the vitamin C, so if you're feeling ill or you're just looking to prevent illness, we've got things for that. So I like to go over all of them because then we have other ones like anti-aging and
Right.
things like that, brain boost. So I like to really hear what they're looking to do, and most likely we have an IV for that.
Can I come
How
once
many
a
do you
week
have?
for the
I'm just
for the fat burner? I want to
Absolutely.
come once a week.
Yeah.
We
Fat
do have a
burner.
fat burner IV that, maybe that's the wrong term, but it will increase your energy. You were
Yeah.
talking about a caffeine IV,
Yeah.
but this has a lot of different nutrients in it that will do the same thing.
Well, the IV we're talking about this morning, do you need to do it over a certain period of time every so often, or are you just cured
is all
immediately and
yeah,
we never see you again?
It is all individual. Some people will come in once a week for
Yeah.
certain types of IV. Some people even twice a week, depending on their level of sickness or their level of wellness, what they want,
Yeah.
what they're trying to achieve.
Marathon runners, people that do a lot of long distance run, they can't stay hydrated. And I mean, it's
Right.
that's where I first kind of heard about y'all. People like that come in, and now it's expanded to not just these hardcore athletes, but your everyday life.
Right, because we do have just a simple hydrate. So if somebody feels they just need, to get hydrated, we have that as well. But we recommend a minimum of once a month just to get one nutritional IV. I do. I mean, I get them at least once a month. Steve does too. So for general health, once a month, and we actually have a benefit for an IV bar member.
Yeah, tell us about that membership.
Yeah, so they can become a member. They get discounted rates on the IVs, and they actually get one IV free each month. And so that encourages them
that's
to come
cool.
in and maintain that general health with at least one IV each month. And then trying out other ones along the way with the discounts.
But you pay like a monthly membership or
Yep, it's
upfront
$99
membership?
a month.
Okay.
Yep, and that gives them that one free IV each month, up to 150, and then they get 10% off all of the other IVs. So
Wow.
that gives them the ability to try out something that they're interested
And you
in.
can do more than one IV, right? It's not like,
That is
oh, you
correct.
got to pick the vitamin B and then you can't do.
Let me also explain this to you. Not all of our IVs require a physician or practitioner to see you. Sometimes you just come in and some of the IVs that you want, for instance, the vitamin C special that I've talked about with the flu, you only see the RN. You don't have to see the doctor. You just see the RN, fill out some paperwork, and we take care of you.
Okay.
But the vitamin C special, I'll give you an example. You were talking about mixing it together.
Yeah.
It has a high dose of vitamin C, vitamin Bs, and magnesium and calcium. All that is in it. One of the staples of IV therapy is called the Myers cocktail.
Yeah.
And it was developed many years ago. We've been using it for a long time. And in that, we have like 13 to 14 ingredients. Most Myers cocktails in other places that you go to, they're pre-made and they only have 4 or 5 ingredients. Ours has 13, 14 ingredients.
Wow.
We freshly make them.
Wow.
Call the number you see on your screen to learn more. See Nicole, she's the one that's going to set you up. And thank you so much, guys,
Thank
for being
you.
here. It was good to finally have y'all on the show.
Thank you. Yeah, tell Connie hello.
This